Ruth invited you all to this meeting today. Ruth is our comms lead, and I know she has been in communication with you, but I just want to say thank you for being here. Thank you for being here on time. We're still expecting some other people to join us. So if you can just bear with us, give us some minutes so we have more people here to capture the conversation from the start. And then we will start shortly. Thank you. Yes. So at this point, I think I will just, Dr. Fejiro, our General Manager, CEO, is here. And I think I'll just hand over to her to introduce herself, and then we will continue the conversation. Thank you.
I'll start by apologizing to everyone that has come in since 10:30. I sincerely apologize. This is not me. I had a meeting that ran over time. I sincerely apologize. And yes, we're starting now. I'm Dr. Fejiro Chinye-Nwoko. I lead NSSF team, and I have wonderful colleagues who are here with me. So, Amazing, is that a good enough introduction? Or is there something else you want from me?
No, I think so, because when we get into it, you're going to talk more about NSSF. And I think we would actually just, you're projecting. Ruth is trying to project. Sorry, I think we'll actually just go right into it, since we have kept people waiting for over 30 minutes. So Ruth is just going to project your talking points or your slide, and then you can go through it.
It's good to have everybody here again. I think this has been our second media Parley, and so I'm hoping that we have familiar faces. Yes, so this is NSSF in a nutshell, and I will talk through it. Our vision for NSSF is a Nigeria where organizations collaborate for better health outcomes for vulnerable and underserved communities. Our emphasis is on vulnerable and underserved communities and improving their health outcomes. We do this by empowering organizations through innovative approaches, partnership, and collaboration to improve health outcomes. And for now, our focus is on improving the leadership and governance for routine immunization. So we are focused on routine immunization. How does NSSF do this, and what have we done so far? Three main pillars for us. First is resource mobilization. We're a multi-donor institutional mechanism. Up to date, we have raised 1.2 billion naira, all domestic funding, and we've done this in partnership with over 11 partners, both in-kind donation and in-cash donation. We've built partnerships. We've partnered with over 20 people, over 20 organizations to strengthen health system. We're a member of the National Emergency Routine Immunization Coordination Center, NERIC, which is a high-level technical working group at the federal level for immunization. We also belong to the HPV technical working group. We have hosted over 15 stakeholder meetings, and just really about strengthening leadership and governance for immunization. We also do a lot of community work as well, and we'll speak more about that. Our results to date in terms of healthcare outcomes, we've helped vaccinate 4.9 million people, and at least one shot of COVID-19 vaccine. We have trained over 12,000 healthcare workers. Our community outreach has reached over 12 million Nigerians, and this is in reducing vaccine hesitancy. We've engaged over 1,200 youths through our annual youth-led advocacy campaign, and we've held high-level roundtable discussion around increasing vaccine uptake in Nigeria, which has reached over 9 million people. our main lever or drivers that we focus on in order to increase the uptake of routine immunization. And we know that this relates to health outcomes because vaccines are one of the most cost-effective way for preventing vaccine-preventable diseases that can lead to death in children under 5. And now also in adults, because we have adult vaccinations as well, HPV being one of them. Our primary level of leadership and coordination, funding, and data management. So by leadership and coordination, we know that we have to hold our leaders accountable, and we have to push, we have to advocate for strategies that will lead to increased uptake of vaccines and reduce mortality, childhood mortality, and adult mortality. Funding is also critical because we are trying to galvanize private funds, domestic resources for sustainable immunization outcome. And then data management. We believe that data is a tool for decision making. And so we have to have a data tool that is open to the public and is also used for advocacy, and it's used as a tool for measuring performance at all levels. What are our solutions? We support the conduct of routine immunization, outreaches for routine immunization in communities in Nigeria. We pick low-performing states using data, again, that we use for decision making. We pick low-performing states. We pick states that don't even have funding from international organizations. And then we pick states that have great political will, that are interested, and that they're advancing immunization campaigns in their states. We do this by supporting outreaches and mop-up exercise for vaccination. Secondly, we have our advocacy channels. And the first one is our youth-led campaign, the WeNaija campaign, which we are launching now, WeNaija campaign, where we galvanize creative youths through digital media to advocate for a health system cause. We know that the youths are the largest proportion of the population. We know their voice also matter because they are the ones that champion the narrative of the country. So we galvanizing youths to advocate for health system strengthening. Our other advocacy channel is our roundtable conversation, where we have government officials, we have policy experts, we have civil society organizations, we have community and faith-based leaders. We also have even frontline workers coming together and discussing pertinent issues, coming to a conclusion and an agreement, and then prosecuting that. Most times we have to come up with a policy brief for action. So it's not just discussion, it's discussion leading to action. And lastly is that we use data for decision making. We're currently developing a digital dashboard that will improve transparency and accountability for routine immunization in Nigeria. Our success story so far, we spoke about our success in vaccination, but our success in advocacy using our WeNaija campaign, because that's something that we're focused on today's media panel, is that we have gathered over 1,200 youths. We have 150 youths who have received prizes in forms of cash prizes and in forms of tools to enhance their skills. We have 78 youths participate in our capacity building session and training to develop their skills. And we currently have 4 of these youths in the internship role, still building their skills, and this paid internship we're able to get for them. Let's go back on that. So why this campaign? Why are we interested in this campaign? And this campaign is termed Awareness to Action. But why this campaign, and why HPV vaccine? We know that the government is in the process of rolling out the HPV vaccine in this October 2023, and we wanted to get ahead of it. NSSF, one of our program areas, like we said, is advocacy, communication, and transparency in what is happening, even at the governance and leadership level. Human papillomavirus is the leading cause of cervical cancer in women and in girls. An estimated 24.5% of women aged 15 to 49 are infected with HPV. And we know that this is grossly underreported because not everyone has gone for the test. So this is the statistics we have, but we know that it is more. 60 million girls and women over 15 years are at risk of cervical cancer. So that will mean that I'm sure a lot of us on this call that are women that are at risk of cervical cancer. Over 80% of new cervical cancer cases occur in young girls and women living in rural parts of Nigeria. So HPV vaccine is a preventive method. It's a vaccine that prevents first the infection and then therefore prevents cervical cancer and death from cervical cancer. So it reduces the incidence of cervical and genital cancer. It is a very, the vaccine is able to prevent occurrence of HPV infection in, I think it has a success rate of over 90%. So it's a very important vaccine. Why is this, what is our goal? We want to increase the awareness. I want to promote the uptake of HPV vaccine. At this point, through social media, I would like to state that we know that there are a lot of myths around vaccine, and the media plays a very key role in demystifying the myths around vaccine. I have personal experiences where even my mom would say that, even when she had us as babies and had my elder ones as babies, people would say, don't take your child for vaccine. So vaccine hesitancy has existed even before COVID, existed before HPV. This conspiracy are not new. They've existed 50 years ago. And we need to really do a lot of work to explain to people that vaccines are not the mode to kill anybody. 2 days ago, I got a voice note from my maid. I didn't know that she sent it to me. And the voice note was saying, there is a vaccine that's about to come out. Don't take it because you can just take it, or don't give it to your girls in the school. It was apparently by a school principal. And she was sending this voice note to other people, other of her colleagues that were principals of schools. Don't allow them come to your school to give the girls the vaccine because they can just fall and die. And I was just saying, oh wow, this is really deep. Like, she didn't say they could have an illness. She didn't say that they could be tracked. This was, they can just really literally fall and die. So it means that we need to do a lot of education on this vaccine, but we also have to know that this is not about HPV. This is really about how the human mind processes something that they don't understand, because it's the same thing that happened when polio came in, until we had children die of polio, children living with disabilities as a result of polio. And over time, people began to become more amenable to vaccines. So it's very important. We want to raise the awareness, and we want to do it through the youths, and we want to do it through social media, because social media is a powerful tool. Almost everyone is on social media. So it's a very critical tool for disseminating information. I'll go to the next slide because of time. So the contest is called the Awareness to Action Contest. And this is a contest where we are calling on Nigerian youths. The Nigerian youths, the definition is 15 to 39 years of age. Those are the ones that can join the contest to win. Of course, everyone can promote the contest. Everyone can lend their voice to HPV vaccine uptake in Nigeria. But we are focused on the youths. and the youths are between our definition. We took that definition from National Bureau of Statistics. Is youths between ages 15 to 39 should join us by creating a video content, a short video content. Help me, guys. I don't know if I think it's about 2 minutes, but more details are in the website. A short video content encouraging, promoting the uptake of HPV vaccine. Details of what they need are on the site in terms of education on what HPV vaccine is. So because before you are able to educate someone, you yourself need to be very educated. Why it is important, what the vaccine is made of, how the vaccine should be gotten, where to get the vaccine, and what are the potential side effects of the vaccine, because I'm sure those are questions that people will ask, are all on the website for everyone joining the contest to be well educated on. And for now, the HPV vaccine will be rolled out to girls between the ages 9 to 14 years of age. So it is for every person at risk, male and female. Truthfully, males are the carrier. They don't suffer from the from cancer, cervical cancer, because of course they don't have cervix, but they are carriers. It's supposed to be for everyone at risk. But for this initial rollout phase by the National Primary Healthcare Development Agency, it is for the 9 to 14 years old girl or child. Of course, by the time we're rolling out phase 2, I'm sure it will be open to other women that are at risk. Everyone is at risk that doesn't presently have cervical cancer or doesn't have HPV is at risk of having HPV. So it should actually be for everyone. But for now, it's for 9 to 14. So the video content is creating awareness for that age group and demystifying their thoughts and giving them the assurance and building confidence in the vaccine, that the vaccine is going to be beneficial to them at the end of the day. Survival rates, mortality rate from cervical cancer is over 60%. Treatment is expensive. So prevention, again, is better than cure. So awareness to action, HPV vaccine video contest, join the contest is what we are. We are appealing to you, our media agency, to help push this narrative. 1 minute, so okay. So yes, and this is where you come in. Please help us drive this contest. Please, beyond the contest, help us talk more about the HPV vaccine. Ask questions, ask for materials that sort of allays your fear or build your knowledge so that you can speak on the topic confidently if you need that. But partner with us to drive this mission. Partner with us to raise awareness for this WeNaija Awareness to Action contest. The link is I think somewhere here we would have the link. These are our board members, and these are our advisory board. The link is www.nssf.ng/HPVV contest. And that is the link that we would want the participants of this contest to join in, and they will get further information on how to join this contest. Of course, they are winning prizes. There are prizes up to 5 million naira for grabs. And there are skills acquisition sessions with our renowned judges. There are also internship slots available for people to win. So it's a very exciting contest for everyone. We want everyone to join. We want over 1,000 Nigerian youths coming and joining this contest and creating video and promoting it for this. Thank you very much. I think I'm open to questions if I'm in line with the agenda. Thank you. And
yes, please. Thank you very much, Dr. Fejiro. Okay. There's one question already from Gloria. I don't know, Gloria, maybe you can just go ahead and unmute and ask a question for clarity. And you can put on your video as well.
Hello? Hello, can you hear me? Hello, can you hear me?
Yes, we can hear you.
Now, I understand that there are 3 doses of this vaccine. I've taken the 3 doses, and now somebody was telling me that single dose. This information is conflicting. And if it's going to be the 3 doses, how do we ensure that those that have gotten the first dose, they get subsequent ones? Then my second question, I don't know why they limit it to, I think we should have a wider scope of coverage. Like the one they did about a week ago, my child was in school. There was no way she could miss class and go for that vaccine. I don't know if they can take it to the schools. Let the schools have access so that everybody can get it in their schools. Because if you want a child to leave school and be absent from school to go to a primary health care center, it's a bit cumbersome. And then you see situations where some people, health officials, I'm just saying from previous experience of what I've noticed, some people can begin to monetize it, and maybe some people will begin to bring corrupt practices into it. Those who don't want to wait can pay something to buy time. This is my observation. Hello, are you there? Hello?
Yes, I'm here. Amazing. You can go ahead.
I'm done.
Okay, thank you very much for your question. So regarding the HPV vaccine that is being rolled out, in fact, one of the delays of the nation rolling out HPV vaccine was we wanted to ensure that we can use a single dose vaccine, so there's no issue of completion, and then of course it's cheaper. You know, you're buying fewer vaccines. So the vaccine that is being given out to girls aged 9 to 14 for free by the government is a single dose vaccine. Anyone else outside this age group has to pay for the vaccine, you know, via other channels, hospitals and health centers. If you have started the 3-dose vaccine, then you should complete that. The single dose vaccine is what is being given free by the government to girls 9 to 14 years. Regarding the campaign, so yes, there's a duration where there's going to be the mass campaign in communities involving the schools, involving the primary health centers, and other public gathering areas. But after this time, the vaccine is still going to be available in the primary health centers. This campaign, and we're talking about the vaccine rollout now, not NSSF's awareness campaign, but the vaccine rollout is for a specific time period to get as many people as possible vaccinated. However, the vaccines will still be available at the primary health center. So if somebody has missed the opportunity, they can always go to the primary health center around them to get the vaccine.
So that brings me to another question. Okay, if it's a single dose and then anybody above the age of 18 should pay for it, what happens to people who have started with the 3 doses vaccine and they could not complete it? Because I understand that at the point, the vaccines became scarce in the market, people could not get to buy. So those who have started and they've taken the first dose or even second dose and they had to make it the 3rd one, what happens to them if they now go for this one that is designed as a single dose vaccine?
So again, thank you very much for your question. But to clarify, this vaccine that this rollout we're talking about is specific to girls aged 9 to 14. For people who have commenced, they need to go back to the health facility to find out if the vaccine they commenced are available. And if not, they can now discuss the option of taking the single dose vaccine, depending on when they took their last dose. But our focus right now is on the vaccine that's being rolled out by the government for free for children 9 to 14 years. So it's a single dose vaccine that will be given to girls for free. Anyone outside this age group is not entitled to the free vaccine right now. So as time goes on, as the age population that's on focus right now is vaccinated, the government can continue to expand and revisit their strategy. But the free vaccine is for girls 9 to 14 years. Anyone else outside this age group has to pay for the vaccine. Yes, please.
Sorry if I'm asking too many questions. So for those who could not make it last week, my child was in school. I tried to make her squeeze out one day. They had one thing or the other to do because she's in the senior class. How will she get it now that the week-long vaccination has elapsed?
To be clear,
It has not started.
Exactly, that's what I was going to say.
It's not started, so maybe you're mixing it up. It has not
What is the one we've been
started.
seeing on social media that they said it was supposed to start last month? There have been information.
No, it was postponed, so it's starting. Amazing, go ahead.
Yes.
A
Yes.
lot of people are not aware of that.
Exactly. So what's the new date, Amazing?
October 24th.
Okay, so.
Okay. So
yes.
when?
24th.
It's a 5-day campaign.
Okay.
But again, like I said, if they miss it in school, they can go to any primary health center around them. Becca,
okay.
Go ahead.
Okay. Thank you.
Everyone.
Becca, I see you speaking, but I can't hear you.
Good morning, everyone. Can you hear me?
Yes.
Good morning. Okay, so I'm concerned about some of the lawsuits I'm seeing on Google. Some universities, some colleges in the United States are suing some of the governments for giving their daughters HPV vaccines and for also saying they will give all the girls in the United States because of the side effects some of them have experienced after taking the HPV vaccine. I don't know if NSSF has seen that, all those articles, those lawsuits. And I also want to know why NSSF says the vaccine has no side effects, the same way Lagos State government has been saying, no side effect. I want to know if our own labs here have done any tests on them to verify indeed that these vaccines have no negative side effects and will not affect the health of the girl child in the future.
I don't know. Sorry, Pedro, do you want me to sponsor? Okay. So before vaccines so first things first. I don't think that anybody will say that anything has no side effects. Even water, if not taken properly, will have side effects. So it's not that they have no side effect, but the side effects are minimal and uncommon. Remember that whenever we do immunization,
Sorry, please, can we mute the mics of those that are not speaking so that we don't have the background noise? Thank you.
Thank you.
Gloria, please, you have to mute yourself. Thank you.
So I was saying, remember that for starters, there's no vaccine, there's no medication that would say has no side effects, right? It's just that we expect the side effects to be minimal and to be few and far between. And the government is very particular about monitoring side effects. Whenever we have immunization campaigns or even routine immunization in health centers, there is a form that is filled to capture any adverse effects that happen from immunization. So it's something that's going to be tracked. And if anything is observed to occur, then it will be treated. It will be documented and treated. There are actually response units that are going to be specifically handling looking into adverse effects. But again, we cannot say that anything is without side effects. However, the side effects are not anything significant. Like I said, even painkillers will have some people can get dizzy, but it's nothing to be worried about. Two, we continue to ask that anybody who has any complaints after taking vaccine should always report to the health center closest to them so that we can actually document these things. And then regarding the vaccines, before any vaccine is brought into the country, it goes through all sorts of processes. There are committees that sit down and review the efficacy, review the literature, compare different vaccines to determine what is best suited for the country. Also, yes, NAFDAC is heavily involved in any vaccine introduction. So Nigeria as a country is not going to accept any vaccine that there's significant body of knowledge saying that, it's like there's something wrong with the vaccine. Let's remember that part of our role is to dispel myths. Part of our role is to reduce vaccine hesitancy. We are at a point in our lifetime, I'll say generally, where vaccine hesitancy is really at an all-time high. And people find all sorts of reasons to avoid taking vaccines. But let's also remember that vaccines have been proven to be one of the cheapest, cost-effective public health interventions, and they have saved lives and continue to save lives. Thank you.
Thank you, Amaze. I will respond to the question on infertility. So I think that's the commonest myth with vaccine, and irrespective of which vaccine, we had that same issue when it was COVID vaccine. People said infertility, and all the people that have taken COVID vaccines are alive and they are fertile. They've gotten pregnant, they've given birth. It's a common issue, especially because we are saying girl child. People would now wonder why the girl child. They don't triangulate that it's the girl, is the woman that has the cervix, and she's the one that is prone to cervical cancer. So we are prioritizing the girl child. Like we said, the males are carriers, they have it, they should also get the vaccine. But because of budgetary constraint, right now, the free one is for the girl child. So it's a myth that everybody keeps wondering whether they are trying to reduce our population as a country. This didn't start with HPV vaccine. Everybody feels, even when we were promoting family planning, people say they want us not to give birth. Everybody and they forget that the commonest or the easiest way for a woman to die is through pregnancy-related cause of death. So everybody is trying, there's a lot of mistrust. Mistrust for the government, mistrust for international organizations, mistrust for medicine. There are people that still don't even believe that, diabetes should be treated with diabetic drug. They still believe that it's a sugar thing, and once they stop taking sugar, it is gone. So it is a deep-seated issue in terms of healthcare education. And prior to now, a lot of the burden for healthcare education rests with the healthcare workers, but we know that the media has a wider reach than us. They have a wider reach. There's so many people we can educate. HPV vaccine is not going to cause infertility. So it's clear there is no relationship with that and infertility. So are the other vaccines that have come out, they have not led to infertility. So this is purely a misconception. Yes, Becca, your hand is up. Please go ahead.
I don't understand. These vaccines are coming from the US, and US colleges and universities are suing the government for some of the side effects that girls experience. And you are saying they don't have side effects to fertility, but these schools already filed the lawsuits. I don't know if we have done any research here in Nigeria, because I know that many people do not even trust our healthcare system. And I would also like to know the basis of these researches and those who were involved in the studies here in Nigeria to confirm that these vaccines do not have any side effects to fertility, like American colleges are now claiming. I'm not saying I trust them completely because they are filing the lawsuit, but there may be some truth in what they are saying. And then always bringing these vaccines to Nigeria, they want to vaccinate our girl child. Every time we see this cancer now becoming more in Nigeria, unlike before. That wasn't something we used to know about. We used to believe cancers were from foreign countries. And that's for Dr. Fejiro. And then the first speaker said, when people have side effects to vaccines, NAFDAC follow up on it, and then you go to the nearest PHC, they document it. After documenting it, what next? I had side effects when I took the COVID-19 vaccine. What's it called? NAFDAC followed up on me for about a month, and after that, that was it. What next did they do? They didn't do anything. I just I had to treat myself by myself. So I'm not really convinced about this HPV vaccine. I'm sorry, I'm not convinced. So I'm trying to also clear my own myths about the vaccines and some of these claims from universities in the US, who are the ones bringing the vaccines. And they are also not allowing the government to vaccinate all their girls. But here in Nigeria, we want to vaccinate all the girl child. Please, I need more convincing.
Thank you, Becca, for being honest. And maybe we should take that before Royal, if you just...
It's a follow-up question. I don't know if I can just ask it's just a follow-up and a concern. I mean, Amazing made a statement that if you have side effects, document it. So it didn't really go well with me until she now made statement that, okay, NAFDAC has gone through and must have tested the vaccine to and okay it for it to be rolled out. But then this NAFDAC we are talking about, I haven't seen any statement from them affirming or giving like, how will I put it? I've not seen any statement from them that okay, go on with this, but considering the controversy that is surrounding this vaccine. So that's my concern. If NAFDAC okays the vaccine, then let them come out and they talk about it and let us be at. I have a daughter, and so I'm so concerned about giving her this vaccine. So please, I need experts to come out to talk about this vaccine. Like what Rebecca said, if the vaccine is coming from the US and these people are raising big issue concerning this vaccine, Nigeria is saying it's okay, but it's not coming from a scientist, or it's not coming from those who we can trust. If NAFDAC is okay the vaccine, let them come out, let NAFDAC come out to say, okay, this vaccine is okay, we've tested it, it's okay, go on with it. Thank you.
Thank you, Royal. Thank you, Becca. I will provide some answers to that. Okay, I'm thanking you because it is important to air your doubts. It is very important not to keep it, but to air it. So I will start with the lawsuits. So they are anti-vaxxers. They're anti-vaxxers, and a lot in the US, just the way that people either advocate for abortion rights and people are anti-abortion rights, right? So there are always two sides to every issue, and it's not only about HPV. When it was COVID, there was a lot of publication, but media, on-air personnel, influencers that were also anti-vaxxers that raised a lot of eyebrow. In fact, I think one of them eventually died of COVID because he refused the vaccines. So they are anti-vaxxers, and their work is to diminish the work of vaccines. That is the agenda. And if in terms of a college, of course, there's all sorts of lobbying for whatever agenda you want. If you want an agenda to discredit the work of anybody, you can pay a college to do it. So I will say that what is the percentage of colleges in the US and how many of them are suing? If we have 50% suing, then we can say, okay, there's a big issue. If we have one or two colleges suing, I would say that it's the work of an anti-vaxxer. And that because it's not the first time. And I'm saying this because of history, right? We have COVID that just finished as a good example. There were all sorts of publications saying, oh, the vaccine is not great, the vaccine is not this. But I'm sure every one of us here, if not all, but a good percentage of us here took COVID vaccine and we are fine and good. So in terms of publication, I would say don't fall into the danger of one side of the story or fall into the danger of one quote. What are the numbers? How many people are raising the issue? What is the percentage? Is it coming from a reputable university, maybe like Johns Hopkins, or a reputable institution that you know is into R&D? Where is it coming from? There are all sorts of private colleges in America that can be paid this amount of money to bring that. So they are anti-vaxxers and they are well sponsored. Is my argument. And if they are well sponsored, what are the ones that are non-anti-vaxxers doing? are we also pushing our own narrative to say that it is good? Someone mentioned that this cervical cancer was not there before. I'm a doctor. So as far as I was in medical school, we had cases of cervical cancer. In Nigeria, we know that many people don't even go to the health facility. So many cases of cervical cancer goes undiagnosed. Undiagnosed cervical cancer has been what it's like when we speak about autism as well. People will say, oh, it wasn't paramount, but a lot of cases were undiagnosed. So we have a data issue in Nigeria. Our data is not the best. We don't have an electronic method of capturing data up till now that is widespreadly used across all facilities. So we cannot say that it is actually increasing in incidence. It's in capturing now that it is increasing. And of course, with increase of technology and knowledge, you begin to find more solutions. So the solution is coming now because we've seen that there is an issue and it has finally come. So it will take a while for us to, but I would say that if you are still undecided, make more inquiries, engage more with us and health professionals, and not just take anybody can say anything. That's the beauty of free media, right? Anybody can say anything and it becomes something that is now news and noise and everybody, but not very few people do due diligence on as to, okay, what is this? You spoke about NAFDAC. NAFDAC approves everything in Nigeria. If they start coming out to make statements for everything, they approve water, bottled water. They approve every medicine sold in Nigeria, they approve. They're not creating an advertisement for anybody. So for any vaccine to be used in this country, it is NAFDAC certified. If you doubt it, then you can go to the National Primary Healthcare Development Agency website where they will speak about the vaccine and there will be NAFDAC registration put for that. But NAFDAC cannot come out for everything, even food that is made, that is packed, that's sold in supermarkets, has to have NAFDAC approval. They can't come out for everything. So why would they come out for this? So it's not something that they do traditionally. They don't come out to say we have approved this. They just put their number and everybody that doubts can go and check. You can just even go to a health facility around you that gives the vaccine and say, I want to check for the NAFDAC number and then check it online to see whether it's true. So that's but NAFDAC is not their mode of operation. So I'm sure that they may not do that. So they may, but it's not likely that they would do that. I don't know if there was something else I missed, Amazing, in the question. I don't know if there's
I think you responded to everything.
Yeah. So like I said, this is open conversation. We will keep having this conversation. Maybe before the end of the contest, we would have another media parley and we can bring representative from National Primary Healthcare Development Agency. So you ask some more questions. We can even get a scientist on board to speak to the production of vaccines. But whatever it takes to get, and please suggest who you want us to bring at our next media parley. Please suggest whatever it takes, we have to do it to be able to get to a point where we are convinced that there is no hidden agenda here. There is no hidden agenda. I think that's the problem. People always feel like there is a hidden agenda, and especially because it's now free, but it's free to the recipient. It's not free to the country, or it's not free to the donor. It's someone is paying the costs. Somebody is bearing the cost. So when things sometimes are free, people think that means there's an agenda. No, but because we know that it takes more resources to treat a disease case than to prevent it. So the return of investment works for the country. We don't have enough cancer centers. We don't have enough radiotherapy. So if the country say, okay, oh, well and good, everybody sort yourself out. And when you have cancer, we'll take care of you. We can't take care of you. So it's also a global indices of how countries are performing. So your country also doesn't want to always come out bottom of every list, bottom of economic and financial list, bottom of public health list. Well, always like at the bottom of every list. So your country is also trying to do something good. So I think it's something that we need to also meet ourselves at the middle.
Thank you very much, Dr. Fejiro. I just wanted to add, so as part of the activities for our WeNaija campaign, we're going to have a Twitter Spaces event on the 31st of October, which is supposed to tackle one HPV and also raise awareness for the campaign. So I think that we'll reinvite you there, and we will we already have plans to have MPHCD there. We'll finalize that plan, since that is something that's a burning concern right now. And as Dr. Fejiro mentioned, we'll have other fireside chat conversations. One is supposed to tackle vaccine hesitancy, which also touches on myths. So as plans unfold, we would make sure to invite you back to participate in those conversations, so we can do more at addressing your concerns, to make sure that we're all on the same page and we can actually achieve the herd immunity that we're trying to achieve for our girls, particularly for the HPV, to prevent cervical cancer. Thank you. So are there any questions for the regarding the campaign?
Hello, can you hear me?
Yes, Mr. Fabian, go on, please.
Okay, as regards the campaign, is there gender bias? Are there more opportunities given to the girl child or the female gender in the WeNaija campaign? I just want to know, since we just celebrated the International Day of the Girl Child.
Okay, Fejiro, I wasn't sure if you're going to answer. So the campaign is an equal opportunity campaign. We encourage entries from girls, boys, people living with disabilities. It's equal opportunity. We are trying to break down inequalities, so we're definitely not going to add to that. As much as the campaign is raising awareness on HPV for the girl child, we expect participation from everyone. Also because we understand that the role of men in women and girl issues is actually really important. We need the male to also support issues relating to the girl child. So male champions are welcome. Everyone who fits the criteria of being between the ages of 18 to 35, living in Nigeria, we would love participation. Thank you. I see a hand up. Okay, Mr. Shola, please go on.
Okay, yes. Thank you. Sorry, excuse me for not using my video. My network is not too steady. Yes. I expected that there was going to be a lot of discussion around the HPV vaccine, but the WeNaija program, from what you've told us, I mean, it's beyond just the vaccine, and we know that our youth, at this moment, I think at this point in time, this is probably the time we have the greatest number of youths who are using social media, and we can see the effect. But the question really is, how do these youths utilize social media, and for what? I believe that is what the WeNaija campaign is trying to really influence, to ensure that the youths maximize, their own potentials through the social media. So I think it will be good. Yes, it's nice to talk about the HPV vaccine, because it concerns the youth, concerns everybody. But looking beyond that, I think you've told us. I can't remember the specific number of youths that you've been able to reach out to right now. I mean, so far. But going forward, I don't know. Do you have a specific target? And I know it's supposed to be a national program, and from the past activities that WeNaija, past activities really, yeah. What are some of the major lessons that you will say you've learned, that, going
Mr. Shola, if you can hear us, we can't hear you anymore.
Yeah, amazing. Maybe we just address the issues he has raised so far until he comes back on.
Okay.
Okay, so I think he spoke about the youth campaign, right?
Yes.
And how we can leverage that, or how many people we have reached out to so far, what numbers we're looking for, if I recall.
Yeah, and what lessons have been from the previous campaigns?
Okay, great. So far we have been able to reach over, in terms of reach, we reach through the youths, we're able to reach millions of Nigerians, but the youths that have registered for the contest, we have over 1,200. This year we want to have registration of over 2,000 people, youths registering to participate in the contest. We want the youths to do something more more beneficial to the country, rather than just focusing on using it as a social platform. We want them to use their platform to advocate for a health cause in Nigeria. And that's why we have this WeNaija. And as a benefit for doing that, we then train them a lot of skills training, a lot of opportunities for internship that can lead to full-time employment, a lot of gift prizes that will be used to enhance their creative skills that they can convert into income. So we're particular about the youth engaging in human rights advocacy, engaging in governance, and engaging in health system building, such that they are active leader of the company. Said they are leaders of today and no longer tomorrow. So we want them to take forefront in that leadership. And in return, we also want to build their skills. A lot of youths now have multiple streams of income that come from things like their creative avenues. So we want them to have alternative income source from their creative skills. And one of the skills that are really largely sought after now are digital skills. So creative digital skills. So we're conscious in building those skills. And so that's why this contest is very important. It's not really all about HPV. It's about youth engagement, youth reskilling and retooling, youth advocacy for health change. So that is really the narrative around WeNaija.
Thank you. Unfortunately, I don't see Mr. Shola back here. So, okay, he's here. I hope he heard. Mr. Shola, I hope that addresses your concerns or your questions.
Oh yeah, yes,
Okay.
yes. I had the tail end. Creative. The creative abilities. I think I got that. Yes, that is quite. But I don't know if you spoke about the expectations. The numbers. Like do you have a number? How many youths in this particular launch? How many youths are you hoping to reach out to? Do you have a target? And how would you? What are your specific expectations really? Going forward, at least looking at the last, and then looking at this, and then looking at the next one.
Great. Okay, so I remember another thing you asked, challenges, right? So one of the challenge is that our contest hasn't got, it's not, we don't get registration from all the parts of Nigeria, all the states in Nigeria. So it's not as much as we want to reach everybody. Maybe we don't have enough media coverage or publicity in certain parts of the country. And we would really like there to be a equal entry into the contest. So north, south, northeast, northwest, and southwest, south, southeast. We want participation from all 36 states. We want them in their numbers. So we're expecting that if we get 10,000 entries, that would be fantastic. That would be a lot of work for us, but that would be fantastic because then we can sieve out the best. So we're looking and we're appealing to you to help someone, because we even have success stories from some of our winners and our interns. And the opportunity is not just joining a contest and winning a contest. It's been life-changing opportunity for them. For some of them, they've become breadwinners for their home just by joining this contest and getting the connections that they have for their life skills, getting job opportunities. So it is you helping to alleviate poverty, if you want to look at it like that. It's you helping increase employment rates. It's you helping the advocacy in Nigeria. Is you helping someone there, rather a sister that falls within this category. So we're looking to get as much as 10,000, 20,000 entries. So far we've gotten 1,200, but we want much more. We want it to be a wider coverage. So if you have media colleagues that are media professionals in other parts of the country that are not here, kindly, send this press briefing to them so that they can also publicize this. And you may never know which diamond in the roughs we would discover, and we would we would build their skills and they will achieve their goals in life. So that I think that's my response to your question. Mr. Shola, I don't know if that answers it.
Yes, it does. It does. Thank you.
Thank you.
Angela says she has a question. Do you want to unmute?
Okay.
Angela, you said you had a question. Has it been answered? You're muted.
Okay, good afternoon, everyone. Can you hear me?
Yes, we can hear you.
No, really, I'm not questioning necessary. Well, my own observation and just an advice going forward is that in Nigeria we have a very poor health seeking behavior, and we tend to attach everything. In fact, if it comes to mental health, we have issues around the meat. It comes to even maternal health, cesarean section, we have issues. So my own inputs in all of these sounds they're expected. So, but that is what is going out there. But it's what we really need to demystify and put things in the right perspective. We should be well informed and not emotion, religious or cultural sentiment. So we should face facts. We are balanced position because of our maybe cultural, religious, or whatever alignment. So I believe that with sustained advocacy, I believe that after the rollout, even during the rollout, over time, the HPV vaccine will be accepted. I remember I did a story where I went to some of the hospitals, government hospitals in Lagos State. That should be last year, October or so, or if not this year, I'll check the time. There were no vaccines, and mothers, a lot of them were complaining They really need this. Who is talking and what we are seeing on social media? But there's also that people are saying, government, we want this vaccine. So we also that went on the field to note that there is a demand for this. We should also ensure that we do the right thing and ensure that the right information backed with facts and evidence-based are passed to the Nigerian public. That is my own observation, not necessarily a question. Thank you.
Thank you very much. Your comments is noted. Once again, I'd like to say thank you to everybody. Thank you for participating, for giving us your time. Today, we've been here for an hour. We are conscious of your time. We're aware that some people joined this conversation at 10:30 and would like to respect your time and the other things you have to do. We appreciate your support and your partnership in getting our information out there, to raising awareness about HPV and about the WeNaija contest. Some information has been dropped on the chat regarding the campaign. Please feel free to follow the link and get further information. You can always reach out to us, of course, through Ruth or directly if you have any more questions around who we are, what we do, and our campaign. Please be sure to reach out if you have any questions or concerns. I don't know if there are any final words. Dr. Fejiro, if you'd like to give any final words, but again, I'd just like to say thank you very much for your support. We definitely need the media in everything we do at NSSF. Advocacy is very dear to us, and one of the things one of our strategies for improving health outcomes or strengthening the healthcare system is through advocacy. And so we try as much as possible to work with the media, and we would like to strengthen and continue to strengthen that partnership. So I hand you over to Dr. Fejiro for any final words, and that's it from me. Thank you very much.
Thank you, Ameze, for this, and Ruth for organizing this at a very short time. Thank you. And thank you to all the participants. You are a critical part of advocacy in Nigeria. You are the change agents that we have. You are the voice that we are relying on to communicate this and all the health interventions that we want to communicate. So you're very relevant and part of us. Let's discuss any concerns you have. Please feel free to reach out to us to clarify any way you are not convinced. Please reach out to us. What it will take to get you there, let us know. We always say that we are very open and you are our partners, so we need you. So anything that you think that we need to do, please reach out to us and be willing to do it. And we look forward to your continuous support in our upcoming activities. Help us promote this contest, help us to increase awareness for this contest, to really help us very well. Thank you very much and have a wonderful day.
Have a good day, everyone.